Welcome to Success with Diabetes. This is the video for Session 2, Diabetes and Our Body Systems. In this video, we'll go over the different organs in our body and what types of complications may arise in each when blood vessels are damaged. By the end of this video, you will know about the complications in people with diabetes, if you can prevent these complications, can the damage be reversed, and who should you contact if you start developing symptoms. Before we go discuss the complications, we want you to know that well-managed diabetes is the leading cause of nothing. Just because someone has diabetes does not guarantee the complications we are going to discuss today actually occur. Please keep that in mind as we move forward. Last time, we talked about blood vessels being large and small, 5 lanes and 1 lane highways. If the smaller blood vessels are damaged by inflammation, the organs that depend on them may experience more complications. Now let's talk about the specific types of complications that can happen when we have elevated blood glucose over a long period of time and what we can do to prevent them. The circulatory system is composed of blood vessels, your blood, and the heart. Nutrients and oxygen are able to get to the different parts of your body in this circulatory system. This system is often affected by diabetes. Now let's start with the complications related to large blood vessels. These large vessels are those supplying blood to the brain and the heart. Your brain controls everything in the body by sending information through the nerves. If a blood clot happens in a blood vessel in the brain, it can cause a stroke. Higher blood glucose over long periods of time increases the risk of getting a stroke because the blood vessels are becoming more narrow and rigid due to inflammation. Some symptoms of stroke are drooping on one side of the face, slurred speech, or paralysis to other parts of the body requiring long periods of rehabilitation. In some cases, these complications may cause death. It is important to have a diabetes team. For people who had a stroke may see a neurologist and their primary care provider for treatment and care. The heart has an important role. It pumps blood through our bodies. Blood contains the nutrients for other organs and body parts to work. The heart is a strong muscle that also needs nutrients. The coronary arteries are the blood vessels that bring nutrients to the heart. Narrowing of these blood vessels leads to angina, which causes chest pain. If the coronary arteries are completely blocked, then the person will have a myocardial infarction, commonly known as a heart attack. People who have diabetes are more likely to have a heart attack. The risk of a heart attack is even higher if diabetes is not well managed, causing protein to show up in the urine. We will have more discussion about protein in the urine later. Symptoms of a heart attack include chest pain, tightness, fainting, fast, fluttering heartbeats, they're called heart palpitations, pain extending to the back, arm, or neck. But people with diabetes are at risk of having silent heart attacks. This can happen when the nerves that lead to the heart are damaged. If that is the case, be cautious for symptoms like breaking out in a cold sweat, having clammy hands for no reason, feeling lightheaded or tired for no reason, persistent heartburn, or trouble breathing, even when you haven't done much. If you have any of these symptoms, check in with your health provider right away. If in doubt, call 911. For follow-up treatment and care, see a cardiologist along with your primary care provider. And remember, if you think you're having a heart attack, call 911. What about the small blood vessels? What kind of complications can damaged small blood vessels cause? The blood vessels can be as small as a strand of hair. They are where oxygen and nutrients are delivered, and where waste is picked up. You may have heard about diabetes affecting people's eyesight. How is that related to the damage due to small blood vessels? Do you think diabetes can cause blindness? Can blindness be prevented in a person with diabetes? First, let's look inside of an eye. When light enters our eyes, it first passes through the lens. The lens changes shape to allow us to focus on objects near or far. The retina collects visual information and passes it to the optic nerve. The optic nerve then transmits the information to our brain. There are tiny blood vessels that supply the retina with blood and nutrients. Let's take a look at some of the possible complications that can occur in people with diabetes. Diabetic retinopathy is an eye disease where the retina is damaged. The small blood vessels supplying the eyes are narrowed due to inflammation and diabetes. These permanently damaged blood vessels are weaker, so they can tear and scar. The scar thickens that part of our retina, which then looks like black spots in our vision. If this continues, then the eyes will try to compensate by attempting to grow new blood vessels. However, the new blood vessels won't develop properly and can leak easily, causing a buildup of pressure, ultimately leading to glaucoma. This is why people with diabetic retinopathy have an increased risk of developing glaucoma. Glaucoma is a disease where the optic nerve is damaged due to increased pressure in the eye. This process can be painless and happens slowly over time, decreasing vision until the person is blind. Cataract is a condition when the lens gets cloudy and rigid. This is because high sugar draws fluid into the lens. Everyone will get cataracts at one point in life, but people with diabetes and uncontrolled sugars will get it earlier. So, what are the early symptoms of retinopathy? You may be surprised to know that 60% of people do not know something is wrong with their eyes. It is important to get screened so you are able to get corrective treatment before you lose your vision. Those with retinopathy who have laser surgery and receive appropriate follow up can reduce their risk of blindness by 90%. See an ophthalmologist or optometrist at least once a year for an eye exam. Do not wait until you have symptoms. Make sure they are part of your diabetes team. The kidneys have an incredibly important job and are also important in controlling blood pressure. The kidneys filter blood, removing toxic substances, producing urine, and keeping what we can use in the blood. It controls the amount of water, salt, and other minerals in our body. Complications from diabetes can lead to kidney disease, also called nephropathy, and can eventually lead to kidney damage or renal insufficiency. Renal insufficiency is when the kidneys are not functioning properly. Albumin is a protein that normally stays in the blood because it is something our bodies can use. When the kidneys are damaged, they are not working as effective filters, and useful substances like albumin may leak out and get into our urine. One of the urine tests can check how much albumin is being leaked out to see how well the kidneys are functioning. This specific urine test is called urine albumin to creatinine ratio test. They will ask you to pee into a specimen cup, and your urine is used to perform this test. For someone with well functioning kidneys, this urine albumin to creatinine ratio will show less than 30 milligrams per gram. If the result is between 30 and 300, then it is called moderately increased albuminuria. Anything over 300 is severely increased albuminuria. The higher the result number indicates that your kidneys are leaking more albumin. If moderately increased albuminuria is not taken care of, the kidneys will continue to be damaged, leading to renal insufficiency. If this condition continues to worsen, less urine is produced, and the affected person may need dialysis. If you have diabetes and you have never been asked to get a urine test done, please check with your primary care provider about getting this urine test. Many times, the kidney has no symptoms, but one of the signs that the kidneys aren't working as well is that you may feel the side effects from your medication more. Since the symptoms of kidney damage are not clear, it is best to rely on getting regular urine and blood tests to check your kidney function. A nephrologist is a specialist to treat kidney problems. Your primary care provider is also someone you can talk to about concerns with your kidney function. Our stomach functions to break down food like a blender. Our intestines then move the food along while absorbing nutrients. Stomach and intestines have nerves. Those nerves generate wave like muscle contractions that move food through our digestive tract. When the nerves in the stomach are affected, the muscle contractions slow down and the person will experience slow digestion, nausea, and bloating because food is not moving. This is called gastroparesis. So, why does this happen? The stomach and intestines move rhythmically, controlled by the nerves. The nerves of the stomach and intestine will not work as well if the blood supply is decreased with damaged blood vessels caused by long term high blood sugars. As part of your diabetes team, See a gastroenterologist along with your primary care provider if you're having any of these symptoms. There are many functions of the liver, including detoxifying, creating essential compounds the body needs, making energy, and storing energy. One of the complications associated with diabetes is fatty liver. Fatty liver is when extra calories are stored in the liver as fat. Fat is not normally stored in the liver, and research shows that fatty liver and insulin resistance are closely related. Higher amounts of fat in the liver relates to worse insulin resistance. Your primary care provider can order tests for that. An endocrinologist, diabetologist, and/or gastroenterologist can also help with treatment for liver diseases. We talked a little about the pancreas in session 1. Remember that the pancreas functions to produce many different enzymes and hormones important for digestion and for regulating sugar levels. Glucagon is a substance that the pancreas releases to increase blood glucose levels when it's low. As a brief review, insulin is the key that unlocks the cell, allowing sugar to be taken in. People with type 1 diabetes don't produce insulin. In type 2 diabetes, there is insulin resistance, meaning the body doesn't use insulin properly. As part of your diabetes team, the providers to see include an endocrinologist or diabetologist in conjunction with your primary care provider. Peripheral means away from the center. For example, your hands and feet. Arteries are blood vessels that transport blood away from the heart. In peripheral artery disease, the arteries in the leg are narrowed. Think back to the one-lane highway. One of the symptoms of peripheral artery disease is pain caused by not enough blood supplying the muscles in your legs and feet during exercise. You may not get enough oxygen and nutrients, which causes cold feet, muscle spasms, it affects your wound healing, and gets skin infections. In severe cases, it may lead to amputation. An important concept that we'll discuss in great detail is diabetic neuropathy, which is nerve damage. Because nerves send signals to and from all of our organs, we can see effects of diabetic neuropathy in many parts of the body. Peripheral neuropathy is when the nerves in the limbs are damaged, causing pain, tingling, and numbness. It usually affects the feet first, then spreads upward. The nerves leading to your feet are the longest nerves, and over time, when the blood vessels are damaged by inflammation, it affects how much oxygen and nutrients are transported to the extremities, like your feet. You can think of nerves and blood vessels traveling together, like in this picture. The nerves and blood vessels have to travel the longest distance to get to the feet, so the area furthest, which is the toes, will have the least amount of blood. The nerves are also affected due to decreased blood supply, which then leads to pain or numbness. The symptoms may be gradual, where you don't notice any symptoms at the beginning, so it's important to see a physician regularly. Once you start having symptoms from diabetic neuropathy, the damage can't be reversed, but you can prevent it from worsening. Some things you can do are wear shoes that are well fitted. If symptoms include numbness, then you can't feel where you're stepping. Shoes that are too loose can cause you to fall, leading to injuries that will have a harder time healing. Shoes that are too tight can make it harder for blood to reach your toes, cutting off your circulation. Well-fitted shoes are important to prevent blisters and ulcers from rubbing. It's also important to avoid going barefoot or wearing flip-flops. Try to get a pair of sturdy house slippers to wear indoors to prevent injuries such as stepping on a misplaced nail or hitting your toe against a sharp container. When blood circulation is compromised, wounds heal slower. There's not enough blood reaching the areas to bring nutrients and to remove waste. This can cause a vicious cycle of worsening wounds leading to amputation. It's important to keep the skin on your feet properly moisturized. Drier skin has a tendency to crack, leading to a wound. Skin that is too moist can create an environment optimal for bacteria growth. Keep the area between your toes dry. The area between your toes tend to be more damp. Washing the feet with warm water every day to keep it clean and free of bacteria. Remember to test the water with your hands first, especially if you have numbness in your feet. Before putting on your shoes, check for any objects such as pebbles on the inside. Wearing white socks is important so you can check them for blood or pus, but be cautious of socks that are too tight or else they can cut off circulation. It's recommended to examine your feet once in the morning and once before sleeping. When examining the feet, look between the toes and look at the bottom of your feet using a mirror. Telescoping foot mirrors can be found in stores such as Walmart, Home Depot, or AutoZone. If you see a small bruise or wound in any area of the foot, consult your provider right away. It's easier to treat when the wound is still small and manageable. Schedule appointments with the podiatrist when it's time to trim your toenails. In between trimmings, it's okay to file. This is covered by most insurances, including Medicare. Microfilament tests should be done at every visit, and always ask your primary care provider to check your feet at every visit. See a podiatrist at least once a year. They are an important part of your diabetes team. What is the number one symptom of microvascular complication? Nothing. A majority of the time, it has no symptoms. Thus, routine screening is important. There are a few things to keep in mind and may help you prevent complications. The best way to avoid these complications is to manage your diabetes. This involves taking your medications as recommended by your provider, trying to keep your blood sugars in the target range, staying physically active, and quitting smoking. And know your numbers. All of these complications may sound very grim, but remember, you have a team who can help. We want you to walk away with the knowledge you need to take charge of your care. We definitely want you to know that these complications can be prevented in most people. Keep track of your appointments on your calendar and set reminders on your phone to ensure you get the follow-up you need. And remember, well-managed diabetes is the leading cause of nothing. First, consider that your teeth and gums can also be affected. Diabetes increases the risk of infections in the gums, which can cause a person to lose their teeth or increase blood glucose levels. High blood glucose reduces the production of saliva, which makes our mouths dry. Bacteria thrive in this drier environment and can cause tooth decay. Our teeth have little blood vessels that become narrow due to inflammation, and if teeth do not get the nutrients they need, then they'll fall out. Prevention tips include smoking cessation, flossing and brushing teeth immediately after meals, or at least twice a day. Avoid having a dry mouth, and see a dentist every 6 months. Smoking harms nearly every organ in our body. In people with diabetes, it can make cells less responsive to insulin. It causes inflammation and damages blood vessels. This means that smoking increases all of the complications we just talked about. Nicotine in tobacco products also increases blood pressure by making blood vessels narrower. Do you know about your blood pressure? Hypertension is another name for high blood pressure. The normal blood pressure for a healthy adult is under 120/80 millimeters of mercury. The recommendation for most people with diabetes is under 140/90 to be considered well managed. For some people, their healthcare provider may recommend a target lower than 140/90. If you have high blood pressure and your provider has not talked to you about your target numbers yet, please check with your provider on what the target is for you. Having a good understanding of your blood pressure is an important part of managing your diabetes. Blood pressure can be kept under control with some lifestyle modifications. Avoid weight gain by choosing a healthy diet. Exercise regularly. Reduce your alcohol consumption and salt intake. Work on proper stress management. And of course, quit smoking. Another thing to keep in mind are vaccinations. You may be asking yourself, why are flu and pneumococcal vaccines important? People with diabetes are at a greater risk for lung infections. People with diabetes are using up immune cells because of inflammation, and thus have less immune cells to fight infections. Also, high blood sugars feed bacteria. So get your flu shot once a year in the fall, and talk to your primary care provider about the pneumococcal vaccine. Next time, we'll talk about nutrition, our food, our fuel. Some things to think about for next class include, what are carbs and why is it important to know? What are your eating habits? Have you ever wondered how you could eat less salt when you don't salt your food? See you next time.